So thank you very much. Ladies and gentlemen, I'm the last speaker. And in 10 minutes, I'll try to do my best and to explain to you the huge problem we have in Greece. Not only in Greece, everywhere. The demographic problem. You know, ladies and gentlemen, when Petros told me to talk about demographic changes in Greece, I thought, what is going on? What I'm going to say about genomics and all these things that we heard this afternoon. There is a small connection, and I'll try to show you what the connection is. So, you know that Greece, as everywhere, but in Greece, especially in Greece, is experiencing major demographic changes such as sharp decline and the aging of the population. And at the same time, advances in genome screening. And I'm going to, at the end of my talk, I'm going to say what screening means. Offer new tools to address health challenges linked to these changes. The presentation tried to explain what's a demographic disaster, why it's happening, and why it threatens the country's economic and social future. So what are the demographic changes we have? Sharp decline of the population, shifts in population size, age in society, very low birth rates, high migration of young people. These are quite serious changes we have, and we face that many years now. I don't know if you can see this. It's the sharp decline population between 2020 and 2026. And I'll tell you, ladies and gentlemen, that within these 5 years, 5 to 6 years, we started with a population 10,700,000, and we are now 9,900,000. The most important is that the median age of the population became from 44 years to 47 years. The fertility rate is more or less the same. And another very important figure is that the urban community, we started in 2020, and the urban community was 82.7% of the population, and now is 90% of the population. And later on, you'll see the projections of all this. So, you see that the Greece population picked up around 2010, and since then, continuously decline. And the projection shows that a major reduction by 2050. And I'll show you by figures and by numbers. The projection is that in 2030, we're going to be 9,700,000. In 2050, we're going to be 8,800,000. That means in 20 years, 1 million less. Also, the median of age is going to be, now is going to be 48.5 in 2030, and in 2050 is going to be 50 years of age. The median age of the Greek population. Also the urban community, and this is very interesting, we started with 19.1.8%, and in 2050, it's going to be 99.3. Can you imagine that? 99.3 of the Greek population is going to live in cities, nobody in the country. So you see the problem is quite big and quite important. The analysis is an organization makes some studies, and they made the study with a pessimistic and an optimistic scenario and a pessimistic scenario, And the optimistic scenario said that in 2050, we're going to be 10 million. And the pessimistic scenario says that in 2050, we're going to be 8.3 million. So that means that we are going to be less between 800,000 to 2.5 million people. But anyway, we're going to be less. So there are 8 different scenarios. I'm not going to go through all this because you cannot understand. First of all, you don't understand Greek. And second, it's very complicated. But they take in consideration migration, mortality, and fertility rate. The important is all these scenarios all are less than 10 million in 2050. And the worst scenario is that we're going to be 8.3 million. Ladies and gentlemen, the problem is quite serious. It's because, first of all, there are few children are born, and the fertility rate, you know, of course, what means fertility rate, is nowadays is 1.34. But the birth rate also, everywhere is declined. And in Europe it's 8.16 per 1,000 people. In Greece it's 6.7 to 6.18 per 1,000 people. Also the fertility rate in Greece since 1960, you see there is a huge decline. In 2081 was 2.1. In 1987 was 1.5. And in 1999 was 1.23. They say that in countries that the fertility rate goes down, never come up again. But anyway, after this 1999, we had a rebound and a catching up that is normal in all these populations. But now, again, it's going down. 2.1 fertility rate means that the population is stable. 1.5 fertility rate means that the population goes to half in 65 years. And 1.3, the population goes half in 44 years. So we are in this stage. The key demographic indicators are the fertility rate, the median age over 45, deaths exceed births every year, and shrinking workforce. This indicator shows the scale of the problem, and Greece has one of the lowest fertility rates in Europe, a very high median age, and more deaths than births every year. And this, ladies and gentlemen, you see how the births are going down. This is in 2008, in 2011, 2010, and this is 2025, last year. Last year we had 66,000 deliveries. And you can imagine that in 2010, we had approximately 114,000 deliveries, more or less the half deliveries we have now. And the possible reasons for that is economic insecurity discourages families, high cost of housing and child care, and delayed marriage and parenthood. And here is what I said to you between the balance between deaths and births. And you see since 2011 is somewhere here, deaths are higher than births. And you are now into 2024 that the births were 68, now it's 66, and the deaths were 126. Huge differences. So the Greek population is approximately 10.4 million in 2025, last year, characterized by aging structure, low birth rate, and projected decline to around 8.8 million to 2050. So, and the demographic profile is dominated by a shrinking young population, which is very, very important, approximately 13% under 15 years of age, and a high proportion of senior over 65. Let's say that we are getting old. Greeks were getting old. Increasing chronic diseases, higher healthcare costs, longer life expectancy. And aging population are more likely to suffer from cancer, from cardiovascular diseases, and from neurodegenerative disorders, increasing demand for preventive and personalized medicine. And you see here the aging society. More than 65 in 1961 were 8.3, and 2014 was 20.5. Less than 24 was 26, now is 14. And is in 1950, 6.7 of the population were more than 65, and 2025 was 22% of the population. So in 2050, we say that the population of children between 3 and 17 is going to decrease from 1.6 million to 1.4 with the optimistic scenario, or to 1 million with a pessimistic scenario. And you heard this earlier this afternoon, I think it was Mr. Souliotis, who said approximately, I don't know how many schools are closed now in Greece, because there are not students there. 700. So the population, the pyramid of the Greek population, you know, in 1928 was a normal pyramid, and you see how this pyramid it will become in 2050. More of the people that are going to be between 60 and 70, less in early ages, and this going up. We live more. And also the immigration of the young people. Thanks God this stopped nowadays, but it was very high between 2011 and 2011 and 2012. And you see how many thousands of young people they left during the crisis, mostly young and highly educated. So it was a loss of human capital. So what are the economic consequences? Labor shortages, slower economic growth, unsustainable pension system, higher tax burden on workers. And the possible solution, family support policies, financial incentive for births, reversing brain drain. This happened. Managed immigration, quite difficult. Long-term economic stability, this is very difficult. So I think that these are the possible solutions. But let's examine how we can compare this with, put together with genome screening. Genome screening allows doctors to identify genetic predisposition to disease before symptoms appear, enabling early intervention. So that means that screening, when we say screening, we perform a screening if we have to pick up a disease, something, but you can't treat, you can't do something for that. Otherwise, there is no meaning to screen. So, with analysis of DNA to detect genetic risks, used for prevention and early diagnosis, and supports personalized medicine. Genome screening can apply at different stages of life. You heard before, newborn to adults, helping tailor treatments to individual genetic profiles. Aging society needs prevention, and early detection reduces healthcare costs, is more cost-effective than treatment, and also genome screening improves quality of life, can reduce long-term strain on the healthcare system. Genetic screening can help couples making informed decisions, reduce infant mortality, maybe, and support healthier births in a low fertility society. I cannot find any other connection between genome screening and the tragedy of disaster. And this we can achieve by supporting reproductive planning, detecting inherited disorders, encouraging healthier pregnancies. And while genome screening has benefit, it also raises ethical concerns, and I'm sure that we're going to discuss these ethical concerns afterwards. Because there is data privacy, genetic discrimination, equal access to screening. Also, we have to have strong regulations and needed to protect privacy and ensure fairness. So, what is the future outlook? If integration in public health care, if personalized medicine and support for demographic sustainability are used responsibly, genome screening can help Greece adapt to demographic change by improving health outcomes and reducing the long-term costs. And this is my final slide, because the Greek demographic decline and aging are the most serious long-term challenges and require urgent, coordinated policy and action, and we needed that in Greece from political way, from politicians, from all the parties. They have to put a program and say that in 10 or 20 years we are going to achieve that as Greece, as a nation. Advances in genome screening offer opportunities to improve population health and sustainability. I would like to thank you very much for your attention, and I'm waiting for some questions. Thank you.